Welcome. Today we are going to go through the process for completing an application for Kindergarten Inclusion Support, or KIS. There are two streams of KIS funding you can apply for: KIS Disability and KIS Complex Medical Needs. The focus of the discussion will be the KIS Disability application. The application forms and guidelines for the KIS program can be located on the Department of Education website. That's www.education.vic.gov.au. Please take the time to read the guidelines before commencing your application. The objective of the KIS program is to build the capacity of funded kindergartens to support the access and participation of children with a disability and high support needs in the inclusive kindergarten program. Prior to starting your application, you should convene a program support group who will provide information to inform the application. The program support group will consist of the kindergarten teacher, parents or guardians of the child you are applying for, educators who have worked with the child, and any other supports the family may have in place. As a group, you will need to assess if the child will meet the eligibility criteria. Do they have a diagnosed disability? Are accessing a National Disability Insurance Scheme package, attending an early intervention program, or undergoing assessment toward the diagnosis? If the answer is yes, you then need to assess if the child meets one of the following criteria. Are they a significant risk of injury to themselves or others? Are they restricted in their capacity for movement? Or do they have exceptional support needs requiring medical intervention? Once this is established, you can commence your application. The KIS application consists of two sections: the KIS support plan and the application form. First, complete the support plan. This needs to be completed for both the KIS Disability and Complex Medical Needs funding. Before responding in each section, please carefully read the question to be answered. Keep your responses clear and concise. Dot point responses usually can clearly convey your message. There is a signature page in both Section 1 and Section 2 for everyone on the program support group to sign. Section 1, the KIS support plan. Here there are 6 boxes to complete. Context of the kindergarten. You need to provide information about your service and the program the child will be attending. Please include the skills and experience of the educators, the management of the kindergarten, the group size, session times, the program, routines and physical environment. Also, please include some information regarding the philosophy of the kindergarten. Should you need to provide contextual information regarding the additional needs of other children, this should be submitted on a separate document signed by the kindergarten teacher and not shared or cited by the parent of the child identified in the KIS plan. Context of the child. In this section, please focus on the child's strengths, abilities and interests. Also, be sure to consider the environments that will best support the child's learning and development. For example, will you need to provide visual cues, or will you need to adapt the program or environment to meet the needs of the child? A common error in this section is to continue to discuss the behavioural concerns of the child. That will be covered in Section 2, so please just concentrate on the question. Existing resources. Identify the resources that are already available to the kindergarten that support the educators to provide an inclusive program. These could include the skills and experience of the educators, the family of the child to be supported, early intervention specialists, etc. Also here, you can identify any adaptations and modifications you can make to the program routines and the environment. Additional resources. Here you need to identify the types of support that are required to include the child in the program that cannot be provided within the existing resources. Some additional resources may include support from the specialist consultant to assist with any modifications and adaptations to the program, specialised training that would support individual children with high and complex needs, minor building modifications that assist the child's access, additional staff to provide a safe and inclusive program for all children. Utilisation of resources. Identify how you will utilise the requested additional resources. This could include some examples of how the team will work together along with the additional assistant and/or specialist consultant. Please avoid writing lists that say the additional assistant will. Always keep in mind that the KIS program and funding is based on a team approach. Roles and responsibilities. Here you need to specify the roles and responsibilities of all those involved in the program. How will the team work together to support inclusive programming for all children? This would include the contribution of the additional assistant if that is the request for support. Also include the frequency of program support group meetings. These should be held once a term at minimum and include input from the family and other support services. Once this section is complete, the program support group should discuss the requirements of the kindergarten and if they need to proceed with a KIS application. Section 2, the KIS disability application. Part 1 is the applicant and child details. Work your way through this section, ensuring that all boxes are checked and sections are completed. Late applications only need to be completed if the application is submitted after the 1st of June. In the year the child will be attending the funded kindergarten program section needs to be carefully completed. Remember, if the child is having a second year of preschool, you will need to complete the text box as to the reasons for a second year. The privacy declaration. Please make sure that the parents have correctly checked the boxes to indicate that they have given their consent and signed accordingly. One parent's signature is sufficient. The details of the early childhood program the child attends is what program is the child attending prior to commencing kindergarten. The details of the early childhood program the child will attend is referring to the 4-year-old kindergarten program the child will be attending. If you are not sure of the session times the child will be attending, please mark to be advised and notify the KIS office once the session times for the child are set. Part 2 is the details of all persons completing the application. This is a signature page for everyone who is sitting on the program support group to complete accordingly. Part 3, eligibility criteria. Please complete the child's disability or area of developmental delay and proceed to the reason for support. 3.3, child is at significant risk of injury to themselves or others. Here you will need to describe the child's behaviour that will need to be taken into account by the kindergarten program to ensure that the child is included in the program, that he or she and others are safe and the risk of injury is minimised. Include details such as the frequency of behaviour and the duration of events. For example, this behaviour has been observed 3 times in an hour for 10 minutes each time. You will also need to identify when the child will require extra support in the kindergarten program. What behaviours are predictable? Are there any known triggers for those behaviours? Include any strategies that will work when managing the behaviours when they occur. When completing this section, it is not sufficient just to identify the behaviour. For example, the child has meltdowns when he doesn't get his way. The panel will require more descriptive examples that includes frequency and duration. 3.4. Child is extremely restricted in their capacity for movement. If you're applying in this area, you would need to describe the child's physical abilities. Include any equipment that will be used by the child to help them move around the kindergarten to participate in the program. Also include when the child requires assistance to move around the kindergarten. 3.5. Child has exceptional support needs medical. Here you would describe the child's medical condition and what kind of support will the child need at kindergarten. How often and when will the child require medical intervention during the program? If completing this section, you will also need to complete Section A, General Medical Advice Form, and Section B, Child Health Support Plan. Before submitting your application, please check all sections are complete. Incomplete applications will be returned to you. Please do not hesitate to contact your KIS coordinator should you require further support.